Dear friends, I'm Dr. Somasundaram Subramanian, a surgical oncologist from Moscow, Russian Federation. I'm the founder and CEO of the Eurasian Federation of Oncology, which is based in Moscow. Soviet Union and of course the inheritant Russian Federation has a unique, I would say, cancer care system, which the rest of the world, I would say, have failed to look at. I mean what I say because by the time President Nixon signed the National Cancer Act in 1971, which in little bit more than 40 years has made US the leader in cancer research and cancer control. Before that, by 1970, Soviet Union already had the largest network of comprehensive cancer centers in the world, having a system of so-called cancer dispensaries, institutes and centers with different hierarchy, where the whole journey of a cancer patient from the local general practitioner to the highest end, the Blohin Cancer Center or the Herzen Institute in Moscow or the Petrov Institute in St. Petersburg, it was a system, and it is still prevalent, and about 110 plus cancer centers are still remaining. The lowest in the hierarchy is the oncologist at the local polyclinic, which is an ambulatory department of a hospital or a separate polyclinic for some small town or city or village. Then comes the dispensary in the nearest city. Then comes the dispensary at the district or the state headquarters. Then comes a system of 7 federal level research institutes in different cities, and at the top of that are the Blohin Cancer Center and the Herzen Institute. So the whole system had a strict hierarchy, and any patient who had been diagnosed of cancer for ages now, for more than half a century, it is mandatory that even if that patient was operated in a non-cancer specialist clinic or a hospital or wherever, it is mandatory that a copy of the discharge summary with all the details, with the histopathology investigation, all those details have to be submitted to the nearest cancer dispensary, or basically to the cancer dispensary where that patient comes from, the region where he is registered as a citizen. So basically, due to that, even though the whole system was controlled manually, those days computers were not there, so every patient literally having cancer, except the basal cell carcinoma cases, which are enormous, which we do not cover totally, every patient is registered with the respective cancer dispensary, and it goes into the cancer registry. So basically, there is a full-fledged population-based cancer registry in the country, which is functioning very well in some places, average in some other places, and not so good in some regions. But by and large, the about 570 to 580,000 new cancer cases registered in Russia, they are real figures, not projected figures. You know, the point is that in Russia, we tend to be, unfortunately, not very well publishing abroad. That is one issue, because the main problem is that less than 5% of the Russian doctors know poor English, and less than 1% know good English. And Russian is one of the 6 UN languages, and they had been quite self-sufficient with terminology and everything. So most of the literature had been so far published in Russian. And in terms of what you say, guidelines is not, the word guidelines should not mislead, because guidelines is usually the word used for clinical practice guidelines, but this could be part, what you mentioned could be part of the practice guidelines in terms of treatment and all is the usual thing, but whatever. So there is a system in place where there are forms for everything, particularly totally fully, it had been a centralized system. So every form has been authorized by the Ministry of Health. And so there are particular forms which is mandatory to be filled, such that only then the patient, when he goes back, for a complicated surgery, he may come to a tertiary referral center in Moscow, St. Petersburg, Rostov or Tomsk in Siberia, then goes back to his place, because there are magnificent distances. Russia is still the largest country in the world, even after the breakdown of Soviet Union. And so the patient, when he goes back with all the documents. There is a connectivity, I would say, because all the documents are stored in the archive, and the patient goes back. If he needs to get the further care, all the documentation should be done properly, then only he'll get the continuity of care. There are two things where Russia as a superpower and Russia as a nuclear superpower and India as a nuclear and pharmaceutical superpower, where these two great nations to which I belong to, in my understanding, have failed. Number one is, these two nations, only of late some work is being done in both these nations in terms of allowing their nationals to die with dignity. Unfortunately, our nations have failed so far in helping people to die with dignity. Enormous amount of people in both our countries are unfortunately dying with enormous uncontrolled pain. And of late in Russia, there is a NGO called Vera Foundation, which is helping hospice to be set up and all. They're doing good job, but still it's not enough. And in India, it is pathetic in many places. Even though there are so many NGOs and others in the government also doing something in both the countries, but it's not at all enough. And in this thing, we have something to learn from Africa. We can learn from the Ugandans. We can look at Hospice Africa, Uganda. They have, voluntary squads going around having their own registry of terminally ill HIV and cancer patients, and they are giving morphine as per the timetable, such that the patient doesn't ever, suffer from pain. And another thing where both our nations have failed, being nuclear powers, unfortunately, both our nations are not nuclear medical powers. As a cancer surgeon and a cancer survivor, what I want both my nations to become nuclear medical superpowers, and it is very much possible. That's a question. There is no oncosystem present in India. Let anybody question me. Yeah, there are great institutions like Tata Memorial, AIIMS is doing a great job. There are many other. There is a private oncosystem of a network of hospitals and all, but there is no full-fledged oncosystem. And it needs enormous will and bypassing the ego of enormous number of healthcare professionals who should be ready to think beyond their lives, who should understand that they are not immortal, who should understand that one day they will also die, and who should understand that every third of them will also die from cancer, and who should understand that it is high time to collaborate. It is high time to join forces and not just repeat what someone else has done just to make money. Cancer is a social problem. Already our governments are doing a lot of programs and enormous amount of money is being pumped. Pharmaceutical companies are spending billions. In the way both of these sectors of the economy or sector of our society, the governments and pharmaceutical companies, what they are doing is what they think is right. But what is the rest of the society doing, including the healthcare community? It's high time they have to join forces and look at their own deeds, what they have done in the past, what they are doing today, what they are not doing right. We both are superpower nations with enormous manpower, with access to information, with internet technology, everything is there, but still, why we are not moving fast? The problem is within us, not with our governments, not with the pharmaceutical companies. So it is high time that we have to think what we are not doing right, what we are doing wrong. It suits not only to India, it suits to even Russia, which has an ecosystem. But still there are a lot of problems to be addressed. Why are we second class or third class nations in terms of giving good care to our patients, including ourselves?